again, everyone. Mark Hackle, Macomb County Executive. John Paul Rea, Deputy Executive, just giving you some of the updates, what's going on with the COVID issue and some of the other things that are taking place here in the county. Again, we see that, the numbers do have a somewhat of an uptick that's going on right here in the county and even throughout the state. I guess it's kind of suspected that that's going to happen. Fortunately, not a lot of inundation with the hospitals, but there has been kind of a inundation with our health department in doing some of the contact tracing. And I say that for this reason. You probably, if you test positive, are going to get a call from our health department, or possibly even the state, more likely from our health department. And if you do, you need to do us a huge favor. One is answer the call. Give them best information you have to help them so that we can at least make some of the contacts with those that you may have come in contact with. I know there's some folks out there that really want nothing to do with that. We've been hearing about that from some of our employees, some of the comments and some of the ridicule that they're going through. These are healthcare workers, healthcare professionals. They'll handle it as delicately as possible. They won't get into a confrontation with anybody. But I'm saying that, and surprising I have to say this, we're hoping that some people will at least be a little bit more courteous if they do call you. So again, it's been pretty challenging, pretty trying for the folks in our health department with some of the comments, and it's pretty amazing they have to deal with that. But again, we're trying to figure out how do we protect others throughout this process. And if you have come in contact with somebody, please help us and provide us the information. So we're looking for that willingness and cooperation.
Mark, again, it's that continuous engagement with the community. As we have an uptick or as we see trends, we respond with the full force, power, and impact of our health department. They're following a confidential and detailed process with regards to the contact tracing, and all they're attempting to do is provide individuals with guidance and options if they do come in contact or if they do obtain the coronavirus. It's something that we have these 60 individuals that have been trained, that very much know how to walk and give individuals these types of information and resources so they can place their families in the best situation moving forward should they themselves contract the disease or if there's any issues with regards to close contact. It's again very confidential process, and in no way, shape, or form will this information be leveraged to harm you or your family. We're going to continue to engage those individuals, provide information with regards to close contacts, and again put the most reputable information out there through macombgov.org. So again, should you receive a call from someone from the health department, they will identify themselves. They will provide with information of the reason for the calling, or if you went out and got yourself a test, they're just following up with regards to the results of that test. Very structured process, very detailed process, and it's something that we uphold to protect the integrity of not only individuals who contract the disease, but may come in close contact with the disease too.
Yeah, we're still doing a lot of testing, incredible amount of testing going on with our health department and throughout the area. Still availability at macombgov.org. If you're still looking to get a test, try to make a determination what's happening. Again, we continue to try to tell people, go ahead and get a test if you feel uncomfortable or if you believe you may have come in contact with someone. Also, we remind people continuously. I can't remember our program that we've done an update or contact I've had with the media where we haven't said follow CDC guidelines. Washing the hands, social distance, and obviously wearing the mask. It does help, but it's amazing how divided people are on both ends of the spectrum about not wanting to wear one because of the constitutional right and trying to force people through criminal fines, I guess, if you will, for not wearing one. The intensity of this is pretty interesting. Most people, I think, are moderate in the middle, trying to figure out, okay, how do I become part of the solution? Willingness to want to go ahead and be part of that solution. But you do have, kind of the extremes that are taking hold of this and trying to figure out how do they continue to argue with one another. Please do us a favor, because we've heard about it. If you happen to be someplace, you notice somebody isn't wearing one or wearing one that you may believe is inappropriately being worn, don't confront them. Pass it on to law enforcement. Local law enforcement does, to some extent, try to engage and try to work through this, and even the employers of businesses that people may be going into. So please avoid the confrontations. It's not something that's necessary at this point in time, and just because you don't believe people should be wearing masks, we don't want you portraying that or your anger on those that are wearing a mask. We have always said, wear a mask. It makes a difference. I know there was some, and I got back through some kind of social media, that there was some trying to give an impression that the county did not support mask wearing, or even myself personally. That is absolutely 100% an incorrect statement for someone to make. So, but yet people want to define you based upon things that may have happened or not happened. And again, I use that because the example of the Supreme Court rulings decision on a Friday, working with our health department, knowing the state was going to move forward to do something on a statewide basis, which is how it should be handled, and they did. They came through with a statewide order, once again mandating that people wear masks in certain circumstances, and that's laid out in the health order from the state. So we have all of that information available through Macomb Gov. macomb.gov.org, and or even our health department that says we support that. And we want to continue to make sure that people are, we don't want to be, I guess, if you will, enforcing if we don't have to. I don't think anybody wants to do that. We're once again encouraging people to willingly comply, willingly cooperate, because it's still in our community. There still is that spread, and we're trying to keep people safe, yourself as well as others. So please abide by that. Wear a mask, and again, try to be somewhat courteous when our health department calls, if they call you, because they realize you tested positive.
Mark, our health department has been at the forefront of the response to the coronavirus since day one. They've not only been informed and integrated with their statewide partners through MDHHS and obviously our regional advocates here as we work with the healthcare system. It's going to be a continuous learning process where we're not only getting that information out there that's at macomb.gov.org that explicitly illustrates and details the elements within the new guidelines that come in from the Department of Health and Human Services, again, under those constitutional provisions that were mandated by the Supreme Court and all those rulings. And we want to clarify all these things day in, day out, not only through these video updates, but through the information at macomb.gov.org. It's one of those things, we don't want to fight about this. We don't want to wag our finger and say, you're doing this wrong. It's, again, providing individuals with reputable guidance of how they can protect themselves and their families.
Yeah, voluntary compliance is the best type of compliance you can get. I've learned that from my law enforcement days. So we're hoping people voluntarily comply. We know some won't, and we'll figure out how do we deal with that. So in the meantime, I got to tell you some other good things that are happening here. You know, we talk about the support we gave through the CARES funding that we had coming from the federal government for our businesses, from nonprofits. Figured out how do we acquire all the PPE necessary to help out locals as well as first responders. But I got to tell you, our Macomb Community Action has done a great job of dealing with the food resources and connecting with people that need some kind of support or help with either rent or dealing with utilities. But Sheila Cote from our senior department did something, or came up with something extremely creative. That was that Ship It program, where we tied into the national chain to take care of the membership fees for seniors here in Macomb County, 60 and above. And boy, that's taken off. I just talked to her earlier this morning, and already we had set an opportunity to go ahead and take care of 2,500 memberships. We did that. In fact, there's now a waiting list of 1,000. So we're working on that right now. What we think we can do is get more funding. We're working with the support of the Board of Commissioners to do a quick bypass procedure for the CARES funding to support additional. And we're actually looking at possibly supporting another 5,000 seniors here in Macomb County for the membership. And it's taken off. We're getting calls from other surrounding counties saying, hey, we like that program. How did you come up with that? Very creative. We want to help our seniors too. They're doing it. Great form of flattery when somebody kind of wants to repeat what it is you're doing. But that being said, Sheila and the senior department really has done a great job of not just Meals on Wheels programs, getting special care packages to our seniors here in Macomb County, but that was one heck of an idea to help our seniors, keep them home, keep them safe, and yet still get them the food deliveries that is going to be paid for through a membership that we're taking care of through the CARES funding. So we're grateful, and we're hopeful that the Board of Commissioners continues to work with us, because they have been doing that bypass so our seniors get taken care of here in Macomb County through that program as well.
Mark, the Office of Senior Services, Macomb Community Action, with Sheila Cote, with Ernest Covey, the entire team has been doing, is responding to how this virus has impacted some of our most vulnerable populations. Obviously, the SHIPT program is something that undoubtedly has got a tremendous amount of interest from the public. We're going to respond. We're going to look for more resources. We're going to expand the ability to serve the public. This is the way that we've not only been strategic with these resources heading into the last quarter of 2020 here, and understanding that it gives us a little bit more programmatic flexibility. This was the intent. We were always purposeful on it, and now it gives us the ability to not only have great programs, but also be on a great financial foundation with some other news this week too.
Yeah, so good stuff that's going on, you know, whether it's our health department reaching out, obviously our emergency management engaging with this process, seeing what's happening with Macomb Community Action, in particular seniors and what they're doing, but even some of the stuff that people don't see is what's going on with our finance department, because we're trying to figure out how do we deal with this crisis from a financial perspective, making sure that the county's in good, solid foundation when it comes to the finances. And boy, I got to tell you, are we ever. Right now, the board is doing their due diligence, looking at the proposed budget we had proposed to them. It's about $285 million of county general funds and about $850 million overall budget, if you will. But the specific one with the county tax dollars is $285 million that we're working on. It is a sound budget, one that I think people are extremely excited about. And I say that because we didn't think that was going to be the case. But credit credit to our finance director, Steve Schmiegel, the work we've been doing with Veronica Kleinfeld, one of the county commissioners, and the rest of the board. They're going to be doing their due diligence, as I mentioned, to kind of go through this, but great article. If you didn't read it, Jamison Cook and the Macomb Daily laid out the conversation he had with our finance director, Steve Schmiegel, and I got to tell you, it's amazing what we've been able to do in light of this crisis to put ourselves further ahead of the game for 2021, 2022, and 2023. So this is kind of a forecasted budget that we put forward, and some of the savings that we're getting through some of the refinancing of bonds and what we plan on doing with paying off bonds sooner than we had anticipated is going to be a great savings to the county moving forward. Incredible what they've been able to pull.
Mark, a tremendous amount of creativity, a tremendous amount of latitude, not only with Steve Schmiegel and his entire team at finance. You talk about the support that we've gotten from the Board of Commissioners, but also the other countywide elected officials and the department heads coming up with creative solutions to the COVID crisis on the first end. But now as we're looking with this sustained response, how we're able to ensure that services do not diminish, but at the same time that we're modernizing every single dollar that comes in, whether it's through CARES Act or the resources at the state level or other external partners around the county. So tremendous amount of credit goes to Steve and his team, and obviously the great supporting cast we have throughout the county too.
Yeah, so even again, paying off some of these bonds early is going to be a huge windfall for the county moving forward with the budget itself, and then obviously refinancing some of those bonds is a win-win for all. I mean, for county residents, taxpayers, even for our retirees. And we've talked about this before. You know, there have been some questions about what we're doing, but again, I've always said it. You know, promises made need to be promises kept when it comes to our retirees. So we've done a lot with our budget, working with the Board of Commissioners and our unions, our labor groups, to make sure that that is the case moving forward. And that's the story we tell. Macomb County is very unique when it comes to our ability to not only be in a good position dealing with our, I guess, our legacy costs, because pretty much we guarantee they're going to be taken care of. But there's even a tremendous savings that the retirees are going to benefit from as a result of, if you will, refinancing of these bonds that deal with our health care for retirees moving forward. So again, extremely creative, but great work being done in cooperation with the Board of Commissioners and in particular our finance department.
Mark, that's $430,000 annually that we're going to save for the next 15 years, just based off of the creativity from Steve Schmiegel and our team, obviously the leadership team here at the county too, working on this and seeing, again, promises made, promises kept. The county's got the financial viability to do it. Let's develop a solution and let's, you know, make a good step forward for the taxpayers of Macomb County and protecting the retirees also.
So we have good things going on here in Macomb County. We want to end it with a reminder once again, follow CDC guidelines, making sure social distancing, washing hands, and wearing the mask, not because you're required to by law, but because you want to be part of the solution. You want to figure out how do you protect yourself as well as others and your family. And again, it only makes sense. And so we want to continue to engage the public to do just that. And please, if our health department does call, answer the call, be courteous to them. They too are just trying to figure out how to be, you know, supportive of what's going on, but also provide solutions to keep others safe as well. So in the meantime, on behalf of JP and myself, we're going to remind you to keep yourself safe as well as your family.